That right. Okay. Go right ahead.
Okay. Good morning. And thank you for the opportunity to speak to you in support of Bill H-224. I've been a diabetes nurse educator for nearly 30 years. I have my master's in public health, and I've been a recipient of acupuncture for nearly 20 years. Initially, I was really skeptical about what acupuncture was. I worked in the Harvard medical system, and this was considered an out there kind of treatment. But for a variety of reasons, I actually tried it and found that it was very powerful, and I've actually been a recipient ever since. So I speak to you today from the perspective that I believe Western medicine as a nurse and acupuncture actually support each other and are complementary. And in my experience, they fit together like a hand in glove. So there are a few points that I'd like to make. One is acupuncture is well positioned to address a wide array of complaints that Western medicine struggles with. In Western medicine, we're fortified with amazing treatments to target specific diseases and illnesses. Yet we're poorly equipped to deal with complaints that are vague, nebulous, and non-specific, such as, and I'm sure you've heard other people say, I can't think my way out of a wet paper bag. I don't know what's wrong, but I'm just not myself. I'm not comfortable in my own skin. I just feel off. I can't settle. Complaints like these affect our quality of life, our relationships, our work, and our productivity. They're vague, and in Western medicine, the best that we can do is either one, say, let's just see what happens, send people out of the office with nothing, or we actually diagnose them with something, like a catch-all diagnosis like fibromyalgia, so that we can prescribe something in hopes that we can actually treat it. Acupuncture actually deals with these complaints much more specifically and effectively in my personal experience. The second point is acupuncture is true preventative medicine. It fortifies the body so that it's less prone to illness and it's better able to respond to medical treatments when necessary. It addresses the root cause of the symptoms, thus, as a result, preventing it to develop into a full-blown disease or an illness. So we're an agrarian society in Vermont, and what I'd like to do is make an analogy to the farmer and the gardener. So we know that farmers really spend a lot of time in cultivating their soil so that when they plant a seed, they get the best crop yield possible. In my experience, having acupuncture is like cultivating my body so that the body is stronger, that it functions optimally, and when necessary to get Western medical treatment, my body's more responsive, and I need less medication, and recovery is faster. Since I've been receiving acupuncture, I don't get flus and colds like other people do, and when I have had to have medication, I've actually relied on very little. Another point I'd like to make is that acupuncture does not rely on fancy technology or pharmaceuticals, rather it utilizes the energy of the body itself to maintain wellness. The body itself is the best computer. That's why we have so much research trying to understand it. But acupuncture taps into that body, using it as a basis of treatment instead of relying on external technology and pharmaceuticals seems to me to be more efficient, reliable, and cost-effective, and it has virtually no side effects. Acupuncture, I believe, is an economical solution for lowering our healthcare costs because we can see effects now. It doesn't rely on expensive technology investments nor decades of pharmaceutical research. It works to really target and address me as a person. What I have found that when I go to see my acupuncturist, I don't get treated, I get treated as a person, not my disease. That's not the specific reason that I'm there. It seems to work. And when I get my treatments target physical ailments, it also leaves me feeling emotionally balanced and mentally clear. So in closure, I want to highlight some of the sentiments my friends and colleagues who receive acupuncture have shared with me. They have said, I've been able to reduce my need for blood pressure and cholesterol medication. I sleep so much better. I think so much better. My health overall is better so that I have no colds or flus, even without the flu vaccine. I used to have bad menstrual pain, and emotionally I was a mess.
Good morning.
So,
And happy spring.
let me jump in. I think have you framed this one?
No, I have not.
Let me frame this a
Just
little
jumped
bit.
right in to start.
Um,
Three of us here.
For the committee's sake and for the room's sake, I want to make the committee available to groups that have an interest in speaking to us. And when we have time, we're going to do that. This fits into the category of there was a request for us to hear about acupuncture issues, and I understand that it's framed in the context of a bill. We're not exactly, you certainly are welcome to advocate for us to take up the bill. That's not exactly the frame here, at least from my perspective. So, thank you everybody for coming, and I'm sorry I missed the beginning of the first one, but thanks.
Again, good morning and happy spring. Chairman Fisher and members of the Healthcare Committee, we are here in support of H224 and to encourage you in including acupuncture in Green Mountain Care. We thank you for the opportunity.
You should say your name.
I will.
Okay.
We thank you for the opportunity to speak with you today about the practice of acupuncture in Vermont. My name is Ann Ramsey, and I'm an acupuncturist with a practice in Essex for the past 10 years. For the first 5 years, I worked at Essex Physical Therapy, often seeing patients who were also receiving PT. I'm also a registered nurse and have practiced in hospitals, schools, clinics, and taught nursing at the University of Vermont, as well as Chinese medicine through continuing education. The reason we are here is because we believe acupuncture works and that it makes a difference in the quality of life in our patients. Acupuncture is already part of the healthcare system in Vermont. Acupuncturists in the state give over 100,000 treatments a year. I want to share with you my perspective from having a foot in both the worlds of Eastern and Western medicine. But first, I would like to tell you how I became interested in acupuncture. As many do, I came to this medicine because of my own health. I was treated successfully with drugs and inhalers for a chronic respiratory problem. I was in my mid-20s, and I knew that I could and should feel stronger. Eventually, I went to an acupuncturist in my area that treated me with acupuncture, herbs, physical and breathing exercises, and stress reduction through meditation. Most importantly, he measured my progress by how I felt and how all of my systems were working, not only my lungs. It took 18 months, but I started to be less and less dependent on medication, and I felt progressively stronger. Acupuncture is not just a procedure. It is part of a system that for thousands of years emphasized health maintenance and prevention of disease. As a matter of fact, it's well documented that in ancient China, the village physician was paid only when his patients were well, not when they were sick. I suggest we try this. Emphasis on and promotion of health has remained a primary focus in our practices. Because of my background in nursing, I wanted to stay connected to the hospital, so I applied for and received hospital acupuncture privileges to treat patients at Fletcher Allen. As part of my hospital experience, I made monthly rounds with the family practice residents. These residents would present patients to me for a different perspective. I only evaluated and treated those patients who requested it and paid out of pocket. One of the patients I saw was a young woman who was in the hospital for an acute gastrointestinal problem. She was there to be stabilized before being sent home to fully recover so she could return to the hospital and have surgery to remove a portion of her intestines. I evaluated and treated her. Most importantly, she and I talked about what she could do at home to not only heal her gastrointestinal issues, but also to improve her general physical and emotional health. The fact that healing was also a viable goal motivated her to become active in her recovery. In the 20+ years that I practiced nursing, I saw a gradual but consistent increase in workload, which resulted in less and less time spent with patients. For this reason, as well as my own personal experience, I turn to a medicine that is holistic in nature, hands-on in the delivery of treatment, emphasizes health as a primary goal, and requires that we spend time with our patients. On average, an acupuncturist will spend between 1/2 and 1 hour with a patient. As an acupuncture student, I learned nutrition, assessment of the whole person, therapeutic exercise, massage, and meditation. These are effective, low-tech, safe, and inexpensive tools that many people want as part of their healthcare and are willing to pay for out of pocket. Although a limited number of insurances cover my services, approximately 80% of my patients pay out of pocket. There is no better testimony to the effectiveness of acupuncture than the fact that most of our patients pay out of pocket. The problem, of course, is that there's many Vermonters who cannot afford to pay and therefore have no access to this care. The use of acupuncture for chronic pain management, PTSD, and prescription drug dependency is now.
Thank you again for the opportunity to talk today. I'm Brendan Kelly, and I practice acupuncture and herbal medicine at our clinic in Burlington, and I'm current president of the Vermont Acupuncture Association. There are about 145 practicing acupuncturists in the state, and the association has 53 members. And I'm here in support of H224 and to encourage you to consider the inclusion of acupuncture in Green Mountain Care. As acupuncturists, we're licensed and regulated in Vermont through the Office of Professional Regulation and certified nationally through the National Certification Commission of Acupuncture and Oriental Medicine. The current requirements for licensure are a minimum of 3 years of full-time post-college graduate level training, which includes at least 2,000 hours of classroom time, as well as passing several national exams, including those in Chinese medical theory, acupuncture practice, clean needle technique, and Western biomedicine. Most acupuncture schools now require 4 years of full-time training after a 4-year undergraduate degree, a total of 8 years of post-high school education, which includes over 2,500 hours of training in acupuncture and a total of over 3,000 hours of training, including herbal medicine. As Anne mentioned, from a poll the Vermont Acupuncture Association conducted in 2010, we provide approximately 110,000 acupuncture treatments that year, and our estimate is the number of treatments we currently provide has increased yearly. We feel the number of treatments we provide is particularly meaningful, as almost all of them are paid for out of pocket, as very few insurance policies currently cover acupuncture in the state. Our estimate is about 93% of the treatments we administer are out of pocket. From several thousand years of continuous practice, acupuncture is an extremely well-developed, safe, cost-effective medical system that not only treats a very wide range of physical, mental, and emotional conditions, but it also excels at preventing disease, and perhaps most importantly, it actively promotes health. From our perspective, unfortunately, we do not have a healthcare system here in Vermont. We do not have a system that cares for health. What we do have is a disease treatment system. In looking at where most of the money goes, the overwhelming majority of it is spent on treating people when they are sick. Of course, when people are sick, they should have the right and be able to receive the treatments they need to help them get better. But according to a traditional story in Chinese medicine, waiting until people are sick before they receive treatments is like waiting for your well to run dry before you start digging. Using another more modern analogy, waiting for people to get sick before they receive treatments is like waiting for your car engine to seize before changing your oil. As with preventing our car engines from seizing with regular oil changes, it not only makes sense medically to have a system that cares for our health, there are very real and very significant financial benefits as well. Currently, there are 4 states that cover acupuncture as an essential health benefit: California, Washington, New Mexico, and Maryland, with 2 other states, Alaska and Nevada, likely to include the coverage soon. In looking at data gathered from California and Washington, the research indicates that the costs of including acupuncture are minimal. Data from California estimated that acupuncture coverage would add approximately 36 cents to $3.70 per member per year. Data from Washington State found that acupuncture coverage contributed an estimated $7.50 per member per year. With regards to cost, the author from the Washington study stated, quote, "Payers have resisted covering CAM, complementary and alternative medicine, providers, in part because of the fear that coverage would result in large, steadily increasing, and unpredictable expenditures for CAM services, not unlike the history of prescription drug use. Our study, done 6 years after the mandated inclusion of CAM benefits in Washington State, suggests that this is not going to be the case. CAM providers in our study practice a less expensive form of medicine. They provide virtually no inpatient services, and as we have previously shown, they rarely use expensive diagnostic tools such as imaging technology. This minimal cost increase in California and Washington is particularly relevant in considering the data from a third study, done closer to Vermont in New York State. That study indicates that expenditures on acupuncture are likely to be offset through reductions in other healthcare services. An analysis of over 18,000 claims in New York found that, quote, "Acupuncture is an economic substitute for medical services and pharmaceuticals," end quote. The study continues to say that acupuncture use was associated with decreasing spending on primary care, all outpatient services, pathology services, all surgery, and the use of all pharmaceuticals, specifically GI and pain medications. With the current discussion about the financial and societal costs of pain medication use and abuse here in Vermont, we believe that the effectiveness of acupuncture in decreasing spending on pain medications, as noted in the study, is particularly relevant. The New York study's author also noted, quote, "Reluctance to cover acupuncture by insurance companies for fear of increased cost may be unfounded."
I'm a member of the Green Mountain Care Board, and I was pleased to listen to this conversation, and I'm happy to join it as you wish.
Yes, so thank you. It's always dangerous to come into this room. There's an interesting dynamic between the legislature and the board that we created. And having been, a number of us been a very active part in the creation of the board and creation of an independent board separate from us for very specific reasons. It is interesting 1 year into, how long have you been?
Year and a half.
Year and a half. We have a handful of bills on the wall that tell us to tell you what to do. And I gotta just apologize everyone. I have a knee-jerk response not to do that. Because my concept of why we created the board was very intentional, that the world of politics around access to healthcare is not the right decision-making place about what is best for Vermont healthcare. We're not good at saying no. And so I guess I just welcome, if you have any comments about the dynamic between, I will say another sentence. I do think it's really important that we help frame from a public policy perspective how the board approaches questions like, for instance, should acupuncture be covered? But just for this individual member, I feel very reticent to do directives about what would or wouldn't be covered.
Well, first, let me just say that we're all in this together. Every Vermonter, and the eyes of the nation are upon us. You passed Act 48. That is my marching orders. So I look to 48 in this matter and in all matters. We are here to do two things: improve health and moderate cost. So personally, as a physician, as a member of the Green Mountain Care Board, as a Vermonter, I'm very interested in any and all approaches to improve health. That's a larger question than simply improving health care.
Mm-hmm.
Secondly, in Act 48, it states very clearly that the Green Mountain Care Board is to approve, reject, or modify recommendations of the administration on matters related to the benefits. So actually, our job is not to come up with a specific benefit or even a benefit package, but rather to review, approve, reject, or modify. So in essence, Robin and the team will put together what they think is the best shot at improving, I hope, health as well as health care, and present it to us. Obviously, I like to think of us, not just that we're all in this together, but that we all really want from our legislative, Green Mountain Care Board, professional, citizen points of view to get this as right as we can. So that means being really open to the evidence. And I would say on complementary and alternative medicine, there's a lot more evidence than there was. The National Institutes of Health have convened not just an advisory group, but an official review panel, and have published, I think, a very excellent report on complementary and alternative medicine. My background is National Academy of Sciences. I'm all about evidence. So I look to national groups that have not just done peer review, but have done real analyses to look at the evidence base for these interventions. So I would just say at this point, we're early on in our discussions. I think it's great to be educated. These are not interventions that I was trained in, so that's why I'm very interested in attending this hearing. And actually, Con Hogan and I had an informal meeting, I guess about 8 months ago, of various complementary and alternative medicine practitioners, just so that we could understand better what the various approaches are. And we identified some themes that came out of that informal meeting. It wasn't an announced public hearing. It was simply an informational meeting for those of us who were interested in learning more. So that's the mode that I would say I'm in at this point. I think we're all in this together. The less mandates in a group that is similarly motivated, I think would be best. We are trying to keep the whole picture in mind as well as the specifics. So in a way, you have the luxury of being able to act request by request, but it's our job to look at the entire effort and the relationship of the moving parts. So I would say the less mandates, the better, but the more joint learning, discussions, clarifications, so by the time we get to the approve, reject, or modify, there are no surprises, because we've all worked along together, starting with the evidence and ending with what's going to improve health and what's going to moderate costs.
I remember in Act 48 discussion, if people feel it, can we go for just a minute or two? I remember in Act 48 discussion, a discussion about not wanting to keep reimbursing for individual services because we have done that in the past. That the measure should be, I think what you just said, what is the best evidence of what works. And I can't remember now whether, and I know that we're one little state, and it's hard for one little state to ask such a big question. I think in the context of acupuncture, I don't know what someone trying to give me the best outcome for the best symptom illness issue. Is it lower back pain? Is it?
There's so many.
Just give me one.
Lower back pain.
Okay. I would hope that when we get to the place of defining benefits, and thank you for reminding me, I really need to be speaking to Robin about this, but that we ask the question, what's the best knowledge out there about treating lower back pain? And,
exactly. Yeah, might I add 2 more points. The first has to do with what's a benefit. We have a very narrow, almost a reflex reaction to that word benefit, as if it really is only covered services from your insurer. But as we move to Green Mountain Care of the Future, I think we should go back to the dictionary definition of benefits, which actually is a contribution to one's well-being. So it's sort of the benefit of doing X, Y, and Z. That, I think, is much more a benefit definition that has to do with health, that puts the person in the driver's seat when it comes to health and different choices for supporting healthy behavior. So even our definition of what is a benefit, I think, should be jointly discussed, and I sure would vote for the dictionary definition of benefits in that case. My other additional point is accountable care organizations, in a sense, transfer the risk and responsibility for making some of these kinds of decisions to providers. I would suggest that we entertain the idea of an accountable care community. And this too has been written about in the literature on population health, where that risk and responsibility actually is not just in the hands of providers and hospitals, but actually is in the hands and the shoulders of communities. So if you then have the outcomes of has this intervention or whatever improved health, and you're paying, let's say, a global budget multi-year, and the outcome is improved health, then it becomes up to the community or up to the community of providers to decide